Hi everyone, welcome to our YouTube channel, Private Patient Advocates with an S. And I'm here today to talk to you about patient advocacy with the Advance Directives. So I've taken down some notes, and this is a form. It's about 7 pages. You need to get the one that's appropriate for your state. So it has directions on the sidelines here as to step by step how to fill out the form, but you might need some guidance. So what I thought I would tell you is why you need a advance directive, and that's to help you design a plan of action just in case you can't speak for yourself when it comes to health care. That's critically important. So it lets others know what kind of care that you want. The more detailed and specific you are on this document, the better it will serve you. So it will guide your loved ones and the healthcare team as to your specific desires. So it is your voice when you don't have a voice. So the clearer you are, the better it is. So it's being prepared. That's very important. And with this pandemic going on, where loved ones cannot have guests or guests, they can't have anybody with them in the room, causes great distress. And it's so unfortunate that this is happening right now, but it's because there's so much unknown out there, and they're just taking the proper guidelines. But you can only hope and pray that your wishes are being adhered to. That's a tough one when you're in the middle of an emergency like this. So when you cannot make a decision for yourself, this is when this piece of paper will be put into action. So who needs to have this piece of paper? All your doctors, all of them. So if you have 10 doctors, they all need to have a copy of it. And your family, I would give it to anyone in your family. And then the person that's going to make sure that your voice is being heard, your spokesperson. So that could be the power of attorney. Alrighty. So the first thing we need to do is understand that a doctor is the only one that can write a DNR. A DNR is do not resuscitate. So that means that the doctor knows, or you have told the doctor, and the doctor says, yes, do not resuscitate on this patient. That means they will not use the resuscitation to bring you back to life if you were to have an episode where your heart stops, or you're flatline or whatever. You don't want to be kept alive. All that stuff needs to be very clearly pointed out. Okay, so only a doctor can write a DNR, do not resuscitate, and no one can override it. Your family member cannot come in there and say, but I want my dad to be, on the machine. I want him on a ventilator, yada, yada, yada. It doesn't work that way. So it can be very frustrating if you don't have your ducks in a row. So what kind of things need to be addressed? Ventilator, that's been on the news for the last 6 weeks. What is that? It's a device, a machine that will breathe for you. It forces air inside your lungs. You could do the research and find out what it does to your lungs and how effective it is, and if you are a candidate or you're not a candidate for it. If you're not a candidate for it, then it's a good idea to say no ventilator. And also, it's up to you to be very proactive on your health, because you need to define exactly how you want your health care to go. Also, tube feeding. Some people don't want tube feeding, especially if it's the end of life. At the end of life, your body systems break down, and it's a natural step towards death. So the different systems in the body slow down and stop. So forcing food into a terminally ill patient may not be what's desired by the patient. So you do have rights, and you do have the ability to speak for yourself. Blood transfusions. Some people don't want blood transfusions, and you might want to check on this, but it takes a lot of different blood of the same type. They pool it all together. Last I heard, it was about 1,000 patients that will donate the blood. They put it in a machine, they wash the blood, and then it's divvied out to the masses. So it's just not one person like me, because I'm O. I give blood, and then you get my blood. It's a whole pool. So different. That's a whole nother subject. Dialysis. Some people want dialysis. Some people don't want dialysis. And that's a personal preference. It's up to you. Antibiotics. Some people don't want it. Put all that stuff down, whether you want surgery, and then that person that is going to make the decision, make sure you talk to that person about how you feel about surgery and if that's the way you want to go. Medications. Do you want pain medication? How do you want the pain medication to be administered? If you can't take anything by mouth, they do have patches, but get all these questions answered so that way it's not more crisis management. The more you have entailed on that paper, the better off you'll be. And then, because once you start getting billed for all these procedures and treatments and protocols that have been administered, it's very difficult to fight it, and then we're responsible for the bill because they gave you the service and you pay for the service. So there's a thing also called the 5 wishes, and the person that I want to make, you pick the person that you want to make the decisions for you. So make sure that that person knows how you feel about healthcare and what you would want to see happen. 2, the type of medical treatment that you want. 3, how comfortable you want to be. 4, how I want people to treat me. And 5, what I want my loved ones to know. So you could add to this list, and the most important thing is to have a witness sign this and then get everything copied. So you put on the last section, required signatures, you put the affirmation here that I am signing below to show that I understand the document, the date, the signature, and then the above person signed this in Advance Directive in my presence. They have 2 witnesses here. That would be ideal, but you have to have at least 1 witness, okay? And there's a website down here, www.connectvirginia.org/ADR, if you want to pull one up for yourself. But they're readily available. If you need any help doing this, I'm available for you. You know how to reach me, 757-513-7771. I hope that you found this very valuable. Please share this video with anyone that needs some extra guidance and wants some help with filling out the Advance Directive and the power of attorney, the health power of attorney. And my name again is Ev. And give me a thumbs up if you felt there was any value to this video. And subscribe so whenever I produce the next video, you'll be the first ones to know.